Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today is Women's Health Wednesday, and earlier this month, actress Hayden Panettiere revealed her secret battle with opioid and alcohol addiction that nearly cost her her career and her life. She also struggled with devastating postpartum depression. As a doctor who specializes in addiction medicine and who has cared for homeless and incarcerated patients with co-occurring mental illness and addiction, Hayden's story resonates strongly with me. Inspired by Hayden's bravery, I'll discuss 5 key facts everyone should know about addiction. Let's get started. Quick disclaimer, I have never personally treated Ms. Panettiere, nor have I directly spoke with her medical team. My clinical judgments in today's show are in response to multiple articles about and interviews by the actress. In this clip, Hayden Panettiere, best known for her lead roles as Claire Bennett on the NBC superhero series Heroes, and as Juliet Barnes in the ABC musical drama series Nashville, shares her first exposure to pills as a teenager.
I'll give you an example. I had somebody that I was supposed to work with, I was working with, who represented me, and she introduced me at 15 years old to the happy pill. And I had absolutely no idea at that time what, really drugs were or addiction was, and she would give me this happy pill before I walked down the red carpet so that I would be peppy and into the interviews, and I had no idea what door that would open for me, when it came to addiction.
Here are 5 key points you should know about addiction. Point number 1. Early drug use increases the risk of future addiction. Perhaps most upsetting to me is that someone on her team gave a young 15-year-old Hayden drugs they called happy pills. This was a trusted member of her team, of her inner circle. Did they have any idea what damage they were doing to this young teenager's developing brain? Did they care? An adolescent's brain is still forming critical neural connections and making decisions that lead to risky behavior. During this time, a teenager's brain is particularly vulnerable to addictive substances like alcohol and opioids. Point number 2. Mental illness and addiction often go hand in hand. Hayden experienced postpartum depression, for which she thankfully sought treatment. However, she continued drinking, presumably to ease her pain and suffering, and she hadn't received treatment for her alcohol use until later. These co-occurring conditions are common. According to NIDA, the National Institute on Drug Abuse, about half of those who experience a mental illness will also experience a substance use disorder, and vice versa. Both conditions need to be addressed. Point number 3. Polysubstance use is not uncommon. Post-mortem toxicology results from drug overdose fatalities often reveal multiple substances in a person's system. Mixing drugs is never safe because the combined effects can be stronger, more unpredictable, and even deadly. Many of my patients speedball, that is, they mix cocaine with heroin to balance the high of stimulants, i.e. coke, with the lows of opioids, such as heroin. Hayden was using opioids with alcohol to feel happy for a moment. That's what drugs do. They make you feel great in the short term. Then, Hayden said she felt worse than before. She recognized that she was in a cycle of self-destruction. That's the disease of addiction. These substances impair parts of your brain that control emotions, behaviors, and decision making. Point number 4. Stigma is a major barrier to care. Of the 23 million Americans with a substance use disorder, only 10% get treatment. Guilt, shame, and other stigma-related emotions prevent people from talking about their addiction and getting the evidence-based treatment they need and deserve. Instead, they continue to self-medicate their pain, as Hayden did for years. They suffer in silence.
I got myself, to treatment. I finally made that call and said, I need help. I need help. I need to go somewhere. And I've been several places, and every place, I took something from and would get a little bit better and would slide back down, get a little bit better. And then finally I realized, I think what was at the core of it was this unresolved trauma. I found a place that literally ripped me open and then put me back together again. And I had to unpack everything and all these memories that came up that I didn't even remember, that were suppressed.
As Hayden demonstrated in that clip, point number 5, most people with addiction, once connected to the appropriate treatment and care, get better. Return to use, aka relapse, is expected and happens with all chronic illnesses like asthma and high blood pressure. But treatment is available. Medications like buprenorphine, i.e. Suboxone, and methadone are effective in treating opioid use disorder. Behavioral therapies, counseling, support groups, and harm reduction tools like naloxone, i.e. nasal Narcan, can all help a person achieve recovery. Hayden thankfully sought treatment, went to rehab, unpacked years of underlying trauma, and is now in recovery. Hayden's experience with addiction and trauma is sadly not unique within the entertainment industry. The disease of addiction sadly took too many lives, including that of Prince, who died in 2016 from an accidental fentanyl overdose, and Heath Ledger, who died in 2008 from a mixture of drugs, including oxycodone. Many other celebrities, however, like Hayden, have been open about their recovery, including Lady Gaga and Brad Pitt, who overcame an alcohol addiction. We as a society need to have more empathy for all human beings who are struggling with substances and need help. So, how can you get involved? If you are struggling with substance use, visit SAMHSA's National Helpline for treatment referral and information. You can also donate to some great charities that work to end addiction, such as the Heron Project or the Partnership to End Addiction. Well, that's all for today. Here's your joke of the day, Dr. Theme. What'll happen to you if you steal a heart? You'll undergo cardiac arrest. Be sure to tune into my show next Monday, 3 p.m. Eastern. Be sure to subscribe to my YouTube channel, rate comments below, and follow me on Instagram at Health Humor Harmony, Dr. Roy. Be well. I'll see you soon.